The flu vaccine campaign across Quebec started early this year.
I don't want to get sick because I'm seniors now.
Our main objective is really to do mass vaccination. The more people that are vaccinated, the better it is.
The flu epidemic will add pressure to a healthcare system already strained by other respiratory viruses and COVID-19. Pediatric hospitals are struggling.
We have had to go over capacity in our ICUs as well and cancel surgeries in order to be able to have the personnel and the beds to look after this. Really was a tsunami of viral respiratory infections in our youngest children.
They just had so many people at one time being admitted and trying to find beds.
Ryan Weichel's daughter just turned 6. He says she spent much of last week in an Ontario hospital with influenza A.
For 4 days, we had nothing but trying to care for our daughter and making sure that she made it through.
She's home now, getting better. More than half of flu cases so far have been among people 19 and under, but others are at risk too.
They're not just children's bugs, they're vulnerable people's viruses. So that also means the elderly and people with underlying medical conditions.
The next few weeks could be hard on the healthcare system, says this doctor.
So it's the beginning of that curve going up. We are likely to continue being busy with every single respiratory viruses and their complication, whether they are pneumonia or other bacterial complications, for the next few weeks.
She says the key is to slow transmission to bring that curve back down. With Canada's flu season officially here, experts recommend a flu shot and a COVID booster to help keep the system from being overwhelmed. Alison Northcott, CBC News, Montreal.